Good day, everyone. Welcome back. In this session, we will continue our discussion on principles of telehealth clinical reasoning in advanced practice. In our previous video, we discussed the structural clinical reasoning that approach to a telehealth case with limited physical examination data. And we said that telehealth clinical reasoning is the structured process of interpreting limited, indirect, and changing clinical information to make safe decisions at a distance. It is an advanced practice skill because clinicians must think more carefully due to missing physical examination and direct observation. So let's dive into what we have in this session. By the end of this session, participant will be able to explain why symptom trajectory is important in virtual care, understand how clinicians should reason safely under uncertainty in telehealth, identify the 3 cognitive biases that can occur in telehealth, and lastly is to decide and document a clear escalation decision based on trajectory or change from baseline, that is, escalate versus monitor. So, in this session, we will focus on why symptom trajectory is important in virtual care. Symptom trajectory means how symptoms are changing over time. A symptom may sound mild if looked at alone, but it becomes more concerning if it is getting worse, happening more often, lasting longer, or affecting function more than before. A mild symptom that is progressing may be more dangerous than a stronger symptom that is already improving. Telehealth clinicians must not only ask what the symptom is, but also asks, when did it start? Is it improving, stable, or worsening? Has it changed since yesterday or earlier today? Is the patient functioning differently because of it? Note: in telehealth, missing symptom progression is a common cause of delayed escalation. Next is, how should clinicians reason safely under uncertainty in telehealth? Uncertainty is normal in telehealth because information is incomplete. The clinician may not be able to examine the patient, confirm findings physically, or get immediate investigations. Safe telehealth practice does not wait for perfect certainty before acting. Instead, it manages uncertainty by thinking in terms of risk. This means the clinician should ask, what is the safest interpretation of this information? What could I be missing? What is the risk if I do not escalate? Is the patient safe to continue in virtual care? Note: advanced telehealth practice requires acting on risk when needed, rather than waiting until the situation becomes obvious or severe. Next thing we are going to look at is what cognitive errors and biases can affect telehealth decision-making. Telehealth can increase the chance of clinical reasoning errors because the clinician may rely too heavily on incomplete or misleading information. These errors are dangerous because telehealth already has limited physical information. To reduce them, clinicians should ask follow-up questions, seek caregiver input when appropriate, compare symptoms with baseline, reassess when uncertainty remains, and think about risk, not just reassurance. Some common cognitive errors include reassurance bias, believing the patient is stable because they sound calm, speak normally, or seem unconcerned. Next is anchoring, holding too strongly to the first impression and not adjusting when new information appears. Another is overtrust in patient self-assessment. This is accepting the patient's reassurance without checking for hidden risk. Another important thing to discuss is, why is escalation a core safety skill in telehealth? Escalation is one of the most important safety decisions in telehealth. Escalation means recognizing that the patient can no longer be safely managed through virtual care alone. They should be able to determine when a patient needs urgent in-person review, referral to a facility, emergency services, faster follow-up, or higher-level assessment. Escalation should be based on increasing risk, worsening symptom trajectory, change from baseline, patient vulnerability, and limits of what can be safely assessed remotely. Note: safe telehealth clinicians know when to continue remotely and when to stop and move the patient to a higher level of care. In summary, symptom trajectory is important in telehealth because symptoms must be assessed based on how they change over time, especially if they are worsening or progressing. Clinicians must reason under uncertainty by focusing on risk, asking key questions, and avoiding errors like reassurance bias, anchoring, and overtrust in patient self-assessment. Note: escalation is a core safety skill requiring recognition of increasing risk, worsening symptoms, patient vulnerability, and the limits of remote care. We have come to the end of this session. Thank you for watching. See you in the next session.